Well, hello. I'm going to take my mask off so you can hear me. Welcome to Facebook Live on this Friday. My name is Steve Long. I'm the CEO at Hancock Health and Hancock Regional Hospital. It is wonderful to be with you this morning. So I want to give you a few updates on what's happening out there in the world and the whole COVID crisis. And I want to give you a few numbers that I think are just fascinating. Because, we've been in this for, many weeks now. It's hard to remember life before this. And we had seen an incredible increase in the number of cases that were coming along. And what we found is that increase in cases has really flattened out. It hasn't so much begun to come down now. I will tell you, New York, it's kind of come down in the new cases. But otherwise, it's really flattened out. So here in Hancock County, we are seeing about 6 new cases a day on average. So if you go out to the ISDH website, you can watch that. On average, about 6 a day. In central Indiana, so that would be Marion County and the counties that surround it and are connected to it, it's about 220 cases a day, and that's just flat, and that's average. In the state of Indiana, it's about 450 cases a day. And then if you want to take a bigger perspective, in the U.S., it's about 30,000 cases a day. Again, it is flat. It is growing 30,000 cases a day like clockwork. And worldwide, it's about 80,000. So you may look at that and say, wow, that doesn't seem great because we're adding cases every day. But what's good about that is that it is predictable. And when you have something that is predictable, it is manageable. And so that is the way that we're looking at this. Now, it doesn't mean there won't be hot spots. I mean, there's a hot spot that's happening up in Logansport right now with the Tyson plant. There are hot spots that are happening all over the country and around our state in nursing homes, because when you have a lot of people that are close together and somebody gets it, then it's likely that it will spread. So there will be these hot spots that come about. But on average, the growth rate is flat, so it's predictable and we can manage that. So what that means is that we can begin to talk about what life in the future looks like. And you may recall that I've said many times that we will not get back to what we would really think of as normal until there's a vaccine, right? We need to get a level of immunity to this disease. So we need that vaccine. It's still 12 to 18 months away. But we can begin to open society again because it is predictable and therefore it is manageable. So as we look at that, I think it's important for us to remember that it's not like the governor or the federal level is going to come out and say, poof, we're all back to where we were. It's going to happen in steps. It will happen in phases. And it's not so important what the rules are, right? This is not following the rules. This is following the intent or the spirit behind the rules. This is a disease that is transmitted by contact. It is transmitted by respiratory droplets. And we know that's how it works, and we need to protect ourselves regardless of what the rules say. And it is the spirit behind it. So keep that in mind. It's very, very important for us to know that. And I will tell you that it can get very personal, because just yesterday I got a call from my daughter, 25 years old, lives in Texas. And she FaceTimed me from her car as she was in line at and drive-through COVID testing facility. So my daughter, as it turns out, probably has this disease. We won't know for 3 to 8 days. Apparently it's pretty slow down in Texas to get the results. But when we look at numbers, we always have to remember that there are people behind those numbers. One of those may in fact end up being my daughter. So as I look at the future, we look at all kinds of data sources, and I can tell you that one of the things I came across this morning was a vulnerability analysis at the county level across the entire country. And it looked at a number of different things. It looked at the socioeconomic demographics of a county. It looked at the healthcare system in a county. It looks at all kinds of things, and it ranks these counties. And I can tell you that Hancock County is among the best in the entire analysis, that we are less vulnerable than many, many other counties in the country. So I feel good about that. So when you put all of this together, what this means is that we are expecting that the next phase is coming, that things will begin to open up, and that means that we are going to become much more accessible to people as well here at Hancock Health. So starting next week and the week after, we will begin ramping up some of the things that we've put on hold for a while. So if patients have had an elective surgery that was put on hold, we're going to prioritize those folks and bring them in to make sure that we can take care of the issue that they've got. If there are imaging studies that are needed, we're going to do those. If physicians need to see patients and patients feel like they need to see their physicians, we're going to help make that happen. And it's going to be phased, it's going to be thoughtful, and we're going to be following the spirit of this whole thing. It's not rules-based. It's really being thoughtful about the process. So please know, we are here. We're safe. We are doing all kinds of things to make sure that we can manage this disease, we can manage the patients, and because it's predictable, it's manageable. So with that, I would encourage you, make sure that you go out and you take a look at our website, hancockregional.org/coronavirus. If you have questions, you can call the hotline, 317-325-2683, or you can send an email to email@hancockregional.org. And remember, we're here for you, and there are brighter things on the horizon. Thanks so much for being with us today. Have a great weekend.